Well, this will be relatively short and sweet from my side. You know, you're welcome to ask, but here's the bottom line. There's a virus in the world that is slightly more severe than flu, not as severe as, you know, I think they called it SARS or MERS, you know, before. Slightly more contagious than flu, but nowhere close to as contagious as measles. Nowhere close. We don't have a case here in West Virginia, but we got to be ready. We got to be ready and make sure that every stone's turned and we're together and we're ready. Now, Jordan, give me this, please. I have convened all these people, and I'm not going to go through all of them, but Kathy Slimp, and it just goes on, who is our, you know, state health chairman. Tom Kirk, who's the Deputy Secretary and General Counsel for DMAS, Clay Marsh at WVU, you know, Jeff Coben, he's the Dean of the School of Public Health at WVU, Joseph Shapiro, he's the Dean at Marshall. You've got Craig, and I'm on, is it Bosworth? Bosworth, there, okay, but he is the Dean. You know, he is the Vice President for Academic Affairs at the Osteopathic School. There's Michael Mills. He's the Medical Director and Regional Director, I guess, of OEMS. I'm not sure what that is. Okay, you've got Sarah Armstrong Tucker, who's the Chancellor of Higher Ed. You've got Clayton Birch, you know, as State Superintendent of Schools. Bill Krause, you got Jim Hoyer, who's the National Guard, Mike Hall, Jeff Sandy, and a whole bunch of community leaders. So the net of the whole thing is we've tried to bring together anybody and everybody that absolutely has knowledge that can make sure that everything that Bill Crouch and all of us have already been working on for a month and put in place, that we're absolutely certain that we're ready, God forbid, if we do have a situation here in West Virginia. So they're continuing to meet and work, and Bill's going to go back, but I wanted to run out and just tell you what they were doing and to give you the news that we're trying to do exactly what our jobs are, and that is to always never have a surprise. That's the whole thing. I mean, in my life, you can deal with most anything. You just can't deal with surprises. And so that's what we're doing. And unless y'all got something earth-shaking that you want to ask, we're going to go back to work. Yes, sir.
I know that, you know, they're currently debating the budget in the House right now. They put, I think, $2 million for a potential coronavirus in that budget. Have you considered, you know, anything from the Rainy Day Fund, any other sources of money to go ahead and set something aside?
Bill.
We're confident that we have funds available through one emergency fund or another. Also, we were on the call, the governor and I had a call yesterday with Vice President Pence and with Secretary Azar, and they pledged a minimum of $2.5 billion to be distributed to states. That number is going as high as $6 and $7 billion. And I understand a little earlier today it was stalled a little bit, but the expectation is that appropriation will move quickly to get money out to states so that we have the funds available. Whatever we need, we'll have. The governor has made it clear, as he said, we need to be proactive. We need to get the folks together who are good at this. Our state health officer, Kathy Slimp, is our point person for this, and she's leading the meeting in there, doing a terrific job in discussing the issues that we need to look for. I talked a little bit yesterday about this is the flu. This is not something new for public health experts across the state. The governor laid it out perfectly in terms of where it falls between the other flus and measles. It's moving a little faster than people thought. The timeline, the first day this was announced in China was December 31st. So when you look at that date and where we are now, it has moved a little quicker than folks have thought. The hope is that this is a influenza that is much like other influenzas, and the flu season will see taper off. Because at this point, the vaccines are down the road a ways. But we know how to deal with this. We know how to handle this. We've got the universities all present in the other room. We're going to be meeting with other folks in West Virginia. The governor's specifically said include everyone that needs to be included in this and make sure we cover our bases. So we'll be meeting with long-term care facilities, the FQHCs, local health folks. So we've already been in communication with local health departments. We already have a system in place of reporting disease and making sure that we test for disease. And so we feel very comfortable. And that's not to say we won't get a case of coronavirus. We probably will. Most states probably will, the way it's moving. But we can deal with that. We can address that, and we're comfortable doing that.
And at this point, what advice would you give to average West Virginians? They're hearing all the headlines, hearing everything in the media. Should people be canceling travel plans? Should they be stocking up on stuff? Are we too early to be talking about that?
That's not necessary at all at this point. I think the best thing you can do is wash your hands. We started yesterday. Anyone heard me on the radio, started with fist bumps, now we're doing elbow bumps. So, don't touch your face, your eyes, and that's a normal precaution in terms of flu season, because hand to mouth or hand to face is where that gets transmitted. So those droplets that come from the respiratory system have a virus attached to it. So that virus in some cases lives longer than other viruses. We're looking at an average, we think, of 5 to 7 days. Keep in mind, this is a virus that's new, so a great deal has been learned in 3 weeks, 4 weeks. So we already know that if folks are in contact with the virus or have traveled in a country, and more countries now are looking at travel bans, Italy, South Korea. But we already know if someone has been potentially in contact with that, quarantine them for 14 days. Stay in their home and don't have contact with other individuals. That's an easy precaution. It sounds a little harsh maybe to some folks, but that's what we need to do at this point. We don't have a vaccine. At some point we will.
Is there anything new that came out of the discussion today? I know you said it's like the flu, and it's just those proper precautions that we already have in place here. But is there anything new that came out today that you discussed that the public would need to know about?
We do have two cases of influenza that we're investigating. So the question is, and CDC has some very specific requirements in terms of testing. So we have some individuals we may send tests to CDC for. Within a couple of weeks, we'll be able to test ourselves. Most states will be able to test. Again, it's an influenza, but you have to learn how to test for that. The kits are becoming available. Vice President Pence assured us that more tests will be coming by next week, test kits available, so that states will be able to test themselves. So it's a simple test for whether or not that particular strain of influenza is in your body. So we have a couple of folks we may end up testing for the coronavirus. We have no positive cases in the state at this point. We are looking at travel. We're also looking at setting up a hotline within a week or two so that anyone can call and get information regarding the coronavirus. So I think we're being very proactive. We have the medical schools on board. We have a nice brain trust in there of folks who really are on top of things.
Is there a time when the vaccine will be available? Has there been any information about that?
My understanding is there are tests going on right now. There are human tests that have begun, but they're really still looking at a year before vaccines will be available for the virus. So we need to look at other precautions. Again, as the governor said, it's influenza. So cover your mouth. There's been a lot of discussion of masks. Masks are much more effective at keeping individuals who have a cold, have influenza, from transmitting that than they are from protecting you. Because again, remember, if you get this virus, it's usually on your hands. So the mask can be beneficial in some cases, but really hand washing, making sure, and we've stopped shaking hands for the most part in the Capitol. No need to do that if we think, if we're in the influenza season. So it's really the basic precautions we've always taken.
The masks are kind of on back order right now. Was there any discussion about getting more masks into the state?
There are, and I'm trying to remember the number, I believe 15 million stockpile of masks nationally. But again, Vice President Pence assured us that more masks are being ordered. And those are mostly for hospitals, folks who are taking care of folks, other folks who are infected. So we've been assured more masks are on the way. The federal government has actually relaxed purchasing requirements for those types of items, and the FDA has relaxed their rules in terms of getting vaccines developed quickly. So they're also on top of this. I think the communication is great. We're going to have a weekly call with Vice President Pence, folks from CDC. Actually, Kathy Slips on the phone with CDC daily. And so we have a great line of communication. Whatever happens, we're aware of what's going on other places elsewhere, and we'll use that knowledge as we move forward.
You said 2 flu cases that might possibly be tested. Where do those go to be tested? And can you tell us what area of the state those are coming from?
I don't know the area of the state, but I can tell you those go to CDC right now. CDC does the testing. I actually just learned this morning there may be one state or two that's now been okay to do their own testing. Those are probably states where there are active cases and community spread. But for now, they go to CDC. I know we are sending one test out today. The other is a possible that we're looking at. So, and that's the kind of thing we'll do just to make sure. We don't want to take any chances. If there's a suspected case that meets the criteria, and the criteria is there has to be some travel to one of these countries or areas or states that has coronavirus. So we're not going to test everyone that has the flu. There was one, I know we had one test that there was a concern. It was H1N1 virus. So we're being very careful, very, very proactive. Again, we've got marching orders here. The governor's made it clear, and we're following those orders.
Let me just say this, and we've all got to understand this. There's a situation worldwide, and we want to be vigilant in what we do. We want to listen to our health professionals and that tell us to wash our hands. Well, that doesn't mean just sticking your hand in the water and that's it. There's an old thing, sing the birthday song with soap and everything, and wash your hands for the length of the birthday song. Wish yourself a happy birthday every time you wash your hands, and then go on and everything. Now, listen to me. But we have to live our lives. We've got everybody. We've got all the horsepower that's on top of this to the very best of all of our abilities. We don't know that a meteorite's not going to hit us tomorrow. We've got to live our lives, and we need to go on, be safe driving a car, because your chances of having a problem with this virus versus driving your car are a lot greater in your car than there are with the virus. We're on top of it as best we can possibly be, and we've got all the horsepower in the world in the rooms and every place, and we've been that way for a month plus the fact that we've been on the phone with the vice president, we're on the phone, we're in constant contact with the federal government, we're watching it as best we possibly can. And God forbid, let's hope and pray that we don't have any issues whatsoever, but I would tell everybody, live your life and go about what you do every day and be smart. And here's the last part of the be smart. My daughter is pregnant and she's got pneumonia, and she's had a tough go of it, a really tough go of it. And she was just telling me just yesterday that the Greenbrier, because she's running the Greenbrier has a chef that's been on a 2-week, tour or learning thing in Italy, and he's on the way back. Well, I would tell anybody and everybody, you have to watch stuff like that, and they need to be not necessarily quarantined, but stay in their house, Stay away from people for 14 days to make sure that they're okay. It's just like washing your hands. Let's be smart about what we do. And then let's go on about living our lives.
That is well said. The thing I'll add to that is to make sure everyone understands, West Virginia is low risk right now for this virus. We are low risk. We don't have a lot of international travel. We don't have a lot of folks who come into this airport necessarily from larger international airports, although we do. And that's where the screening is done in the large international airports. So we are being very proactive. We are watching this. It's low risk, as the governor said. You need to go on about your lives. We'll add finally, that last thing is, if that changes, we will let you know.
Absolutely. Absolutely. We'll keep you posted. Thank you.
Thank you.